Hello, and thank you for your support of the Old Bags Luncheon and YWCA Greenwich. The Old Bags Luncheon is a highlight for us every year when we come together to acknowledge domestic violence as the insidious and pervasive issue in our community, to show our solidarity with victims and survivors, and also to have a little fun. Since the Old Bags Luncheon last year, a lot has happened for all of us. For DAS and for victims and survivors, the COVID pandemic has brought new challenges that we could have never imagined. But as any survivor of domestic abuse knows, being resourceful and able to quickly adapt is a most important survival skill. And so our team got creative and quickly adapted to ensure that we could still be there for our clients in every way. While our hotline continued to be live 24/7, our advocates began offering phone and video counseling sessions as well as support groups in order to prevent any break in service for our clients. However, for many, staying home and staying safe are not the same thing. Increased isolation and disconnection from supports like friends, family, and other activities left many feeling even more alone and more helpless. Victims were trapped in their homes with abusers with no respite, such as going to work or their abuser going to work. Victims were restricted from reaching out for help when their abuser controlled their devices, listened in on phone conversations, read emails and texts. Fear of the virus prevented many from escaping to a family member or friend, and especially a domestic violence shelter. But as I said, our clients are resourceful and continue to do whatever they could to be as safe as they could. Calls on our hotline came in from a victim who called from her closet whenever her abuser was in the shower. Several clients had their phone counseling sessions from the car, and one while walking her dog. Still, there were real barriers for victims and survivors that no amount of creativity could overcome. Abusers found new ways of using the virus as an additional tactic to exert their power and control over their partners. Threats to deliberately expose them to the virus, and then on the other hand, threatening to throw them out of the house if they became sick. Forcing them to practice extreme measures like obsessively washing their hands until they were raw and bleeding. Preventing access to medical care if they did contract the virus. And at the same time, some of the usual protections were not as available or effective. Although procedures were eventually put in place where victims could apply for restraining orders electronically, this e-filing was nearly impossible for victims who were quarantined at home with their abuser. And if an order was granted, serving the abuser with it while at home together could increase the risk of violence even more. The courthouses were closed and only addressing high priority matters remotely. These included criminal arraignments for family violence, but at any case that had already been open was delayed with fewer court dates, resulting in a reduced monitoring of offenders. Victims and survivors in family court were not able to file for modification to court orders, including enforcement of child support and custody matters. This year has taken a toll on all of us, but perhaps even more so for our children. While young people are resilient and have also adapted to this new normal, children experiencing or witnessing domestic violence have suffered greatly during the time of COVID. With schools closing and remote learning in place, children were home 24/7 and even further exposed to violence in the home, whereas school and extracurricular activities had been a break from the abuse. Playdates and sleepovers are no longer a thing, which may have been a significant aspect of their safety plan. Reduced interactions with other adults, such as teachers, coaches, guidance counselors, and other instructors, meant less opportunity for support and for intervention. For many of the reasons I've already discussed, the data from our program shows that there was a decrease in the number of people reaching out to us for help during the shutdown. However, we know that doesn't mean that there were a decrease of level of violence taking place or that fewer people were suffering. And for those who were reaching us, they were presenting with much higher levels of need. The violence was escalating, anxiety was high, and there were practical needs for food and other basic necessities at a level that we've never seen. Clients who had been coming in for weekly counseling before the pandemic were now also calling our hotline several times a week for additional support and safety planning while in crisis. So while the number of people coming to us was a bit lower, the number of services that we provided literally doubled. We anticipated that once the restrictions were loosened and people started going out more, that we would have a surge of people coming out to us who were in need. And we were right. In the early fall, we reopened for in-person services while continuing to work with people remotely. We always prioritize those in immediate danger or crisis, but for the first time ever, we've had a consistent waiting list for counseling services. Victims and survivors in our community need us now more than ever. We are so fortunate to have the amazing team of staff at DAS, experienced clinicians who are compassionate, knowledgeable, and truly dedicated to their work, as well as our educators and community outreach who help keep DAS visible and accessible to those who need us. But we couldn't do it without you and without your support. So on behalf of victims and survivors, I thank you again for your commitment to helping us fight to end domestic violence in Greenwich. And thank you to our amazing Old Bags committee members for your incredible dedication.